of Health has spelled out a raft of changes it is undertaking in the countries. I'll take that again. The Ministry of Health has spelled out a raft of changes it is undertaking to secure the country's blood bank systems and eliminate cartels profiteering from trafficking blood. The Health Cabinet Secretary Mutahi Kagwe says among the key reforms in the use of technology to track and trace online distribution of blood. He urged Kenyans to donate blood during a planned drive this weekend to mark Valentine's Day. Yusuf Farah with the details.
The country continues to grapple with the problem of blood shortage months after it emerged that unscrupulous persons were trafficking blood from the country's blood bank for export, an issue that the Cabinet Secretary for Health Mutahi Kagwe says is now a thing of the past.
So what we have done is made the changes that you can see for yourself, and including personnel changes, so that we are able to work and move forward. Yes, investigations are important. You'll find out what is going on, but more importantly is moving forward.
According to Kagwe, the Ministry of Health has undertaken a three-pronged approach to secure the integrity of the country's blood bank.
And I can assure Kenyans that going forward, what you are going to see is something exciting.
The first phase of the reforms is the establishment of a web-based inventory that accounts for collections and distribution of blood. The second phase is a blood inventory management system tracking blood bags. And the third phase is a vein-to-vein sharing platform with both private and public facilities to track the distribution of blood.
In other words, ladies and gentlemen, what we are saying is that the announcements that we are making today are things and steps that are going to have a fundamental impact in the way that we manage blood in our country.
At the same time, he says plans are underway to create a national blood reference laboratory that will maintain blood registries, gene banks, and regulate annual rationalization of blood needs, as well as establish the National Blood Transfusion Services as a semi-autonomous agency. He was speaking while officiating the Valentine's Day blood donation drive set for this weekend countrywide, where he urged Kenyans to show love by donating blood. Health appears Susan Muchachi says they're revitalizing the blood bank in the country.
Let me also say that we've worked hard to mobilize resources for this, because change cannot come without having resources behind it. And so I want to also take this opportunity to just say that the World Bank, as they have supported us for COVID, they've also allowed for us as a country to receive funding to support blood. Indeed, sir, this year they have given us a total of about 1 billion shillings for purposes of revamping our infrastructure for blood services.
Asha Dafala and Kennedy Sanya were recognized as the country's leading blood donors, with the two having donated 66 and 95 times respectively. Earlier, Kagwe met with state corporations in the health sector for the signing of performance contracts. During the ceremony, he challenged them to practice personal responsibility when dealing with the lives of Kenyans.
They don't see annex. They don't care about Mutahi Kagwe. They don't care about you. All they care about is this. When I walk into a hospital, when I walk into a clinic, how am I held? Was I treated well? Did I find medicine? Did I come out of there knowing that I am better having walked in sick?
The CS has said the signing of the contract is a small part of the wider picture, and that the true reflection of their workmanship will be realized in their service delivery to patients. Yusuf Farah, Channel 1 News.